where I exactly want to put that lift. You can see, you know, some places I put it and it doesn't really have a lot of effect, but if I just get the right spot, it actually has an effect all the way throughout here. Now, she has very full cheeks anyway, so some people might be wondering, boy, she has pretty full cheeks, why do you want to put Voluma in her cheeks? You know, her cheeks are already pretty full. It's actually, you know, her cheek is pretty full here, she doesn't need the volume here. She actually needs it more over here to kind of recreate that lift. Now, she has had some already about 8 months ago, I think. It was about 8 months ago that we put a couple of syringes of Voluma in. In the study that I was involved in, the average number of cc's was 6 cc's, so that's 60 syringes, 1 cc syringes per client was in the study, and that lasted 2 years. So when we're talking about putting in 2 cc's, you can see that you might want a little bit more to keep it up, you know. So do you even need any numbing? Usually we would put some topical numbing, and she says, oh, I don't need it. She's totally professional. Yeah.
Injection in one area, or do you move the needle to several areas?
I'm kind of moving the needle to several areas. So I've switched to, it looks like a much longer needle, but it's a blunt-tipped cannula again. I've just made a small hole in the skin that I can enter. And I'm just going to glide it underneath the skin here.
That's really neat.
That doesn't hurt at all?
So right now, I've actually been able to get all the way over here for the injection. You can see I'm inflating that area right now.
Whoa, there she goes.
And the benefit of injecting in that area, Dr. Erickson, does that create more lift?
Yeah, it's creating lift for the jowl in this area. You can see what it's done already to here.
Absolutely, there's a lot more definition there.
Right? And
yeah.
And I'm still leaving a contour for her cheekbone.
Once again, Dr. Erickson, this is Juvederm?
This is Juvederm Ultra Plus.
Okay.
In the nasal labial fold.
What are you doing here, Dr. Erickson?
So I'm just filling the Marrionette line here, which tends to get deep on women, especially when we age. Sometimes it takes more than one session to get a really great result in the Marrionette line because it sometimes is so deep and hasn't been worked on. But it's one of the first areas that women start to notice that they start looking like they're having a jowl. And right now I'm working on the chin crease. So you can see I'm all the way over here, changed directions. So I'm just going to massage that for a second.
Ooh. That looks beautiful.
So when you do right here,
Putting that
Before,
line down.
after, before.
Yeah, I mean,
Just going right up into the marionette. And sometimes in this area you can see it doesn't glide as easily just because sometimes those marionettes can be almost like scars because they're really tethered down to the tissue underneath. And so you just kind of have to be patient.
Insurance. Excuse me. They want to be done.
Here we go.
It was all the way over to here.
It was. All right, so that's Voluma and Juvederm. Juvederm Ultra Plus last.
Ta-da!
When I make the hole for the cannula, she feels that needle prick, but then it's very comfortable with the cannula just because, you know, the cannula is basically gliding underneath the skin.
It's not going through a lot of tissue.
The results are instant, right?
Right.
Yeah.
Yeah, can you see the difference between this side and this side? How
It's not from swelling, it's like actually.
Right.
No, this is the product.
Okay.
Yeah. And I get so excited when I see 5 or 10 or 15 or I was really aged when I started coming here.
Yeah, we have a photo in our before and after book in the front of her when she first came into our office. The very first day we have a photo from her, and like the transformation is really